All right. Okay, all right. So today I'm just gonna share with you a little bit of information about when your bite isn't quite right. There is a potential you can crack, you can break your teeth. So here I have a young man. He's actually very young. He's 22 years old. He cracked the tooth, and I'm gonna show you in a picture. Here you can see the cracked tooth. And then he didn't do anything about it. And he came back to me a few weeks later with a big abscess. You also see the picture of what that looks like. And here you can see the abscess. And so what we ended up doing was we took the tooth out, we cleaned all that infection, we bone grafted it, we let it heal. And so that whole process is about 3 months process. And so once I have everything good and healthy, then I was able to here you can see the extraction site healed and the bone graft looking good. Computer design, implant placement. So we kind of figured out, where that implant should be. And then here you can see the implant process. So most people think, I'm going to go to a cheap place so that I can have an implant place. But, frankly, so implant is you need to have a lot of planning ahead. So obviously, as you can see, I am planning my implant. You can see on the right side my CBCT 3D scan. So I will know where the nerve is, where the implant should be placed, what does that look like when the tooth is gonna occlude with the opposing teeth. And so obviously you can see where that nerve is right there. And so we want to stay away from the nerves. So when we place the implant, there's no nerve damage. So there's a lot of stuff involved, So like I said, most people think I'm going to go to this country or to that country because it's cheap. But I'll tell you right now, that would be the worst thing you can do because, you want to be thinking ahead and you want to have these implants done right the first time. Implants will fail. You will have complications. And I have seen a lot of implants failing. I have seen, especially in other countries that go and it's a quick fix. It's cheaper, of course. There is a reason why it's cheaper. So this is kind of how the implant process is. Next, you will see my implant is already placed and just waiting to heal. And, place the implant is healed. So in the last photo, you'll see all the implant is healed nicely. And then the last step is going to be putting the crown on. That step is not done yet. Hopefully when it's done, I'll update you. Gracias.